Hello, caregiver family. I am so thankful that you've chosen to tune into this episode of the My Favorite Girl Caregivers Corner podcast. If you're a returning listener, welcome back. I'm elated to bring to you another care empowering, inspiring, and strengthening conversation. If this is your first time listening, a warm welcome to you as well, and thank you for listening. Before we dive into this episode, if you haven't already, as I do on every episode, I ask that you'll take a quick moment right now to subscribe to the podcast from whichever platform you are listening on. We're on Spotify, Apple Podcasts, iHeartRadio, YouTube, and of course on the website. So go ahead right now and subscribe. Hit that subscribe button so that whenever a new episode is out, you'll get a notification and you can go ahead and go listen. And hey, do me a favor, don't forget, go ahead and share it with your family and your friends, especially those who are serving as caregivers, those that are on this caregiver journey as myself. Also want to take a moment to also send a heartfelt thank you to everyone that's following me on my social media platforms. That's where I will share motivational, educational, and inspirational information out there for others that are on this caregiver journey. And then I also share those caregiving experiences with my mama, who y'all know I affectionately call my favorite girl. There's video footage out there. A lot of times we'll sit around and just have conversations, the type of conversations that we can have that she can still have. And I've actually named that, conversations with my favorite girl. And it's, always heartwarming. Always, just interesting. I have people that tell me all the time that they look for those videos. And so you can go out there, get all that information off of the social media platforms. And so those platforms, you can go to Facebook and Instagram at My Favorite Girl in Alzheimer's, on YouTube at My Favorite Girl Caregivers Corner Podcast, and on TikTok at My Favorite Girl in Alz. My Favorite Girl in Alz, ALZ. So go out there, go like it, subscribe, and then do me a favor, share it with your family and your friends. All right. So let's get into this particular episode. One of the main goals of this platform is to offer valuable resources, support, networking, advocacy opportunities for those that are caring for their loved ones and their families. And through my nearly 10-year journey, what I've discovered is that there are countless resources out there that are available to our community that many people aren't even aware of. And not just that, but a lot of these resources are free. And y'all know we like that word, free. But when you don't know, you can't take advantage of them. So with that in mind, what I've done on the past few episodes is I've sat down with coordinators from these agencies and organizations that can provide the resources to you, because we want to help spread the word and let people know what's available and how you can access what's out there. I always say knowledge is power. What you don't know, you don't know. But when you have the knowledge and you can take advantage of it, that always helps. And right now in the society that we live in, especially, we all need to know what's out there and how we can access it. And so on this particular episode, I'm talking with Yolanda Gillette-Carlson of the Big Bend Area Health Education Center, better known to a lot of us here in the Tallahassee area and surrounding areas as Big Bend AHEC. And so we're talking today about Big Bend Area Health Education Center building stronger, healthy communities, stronger and healthier communities. And so just to give you a little bit of background on Big Bend Health Education Center, they are an independent nonprofit organization established in 1995. Their mission is to provide health education and promote partnerships to improve community health. Big Bend AHEC seeks to be the thriving or the driving force toward optimal health for thriving, kind, and equitable communities. Big Bend AHEC provides services across 14 counties in the Florida Panhandle, including Taylor, Madison, Jefferson, Leon, Gadsden, Wakulla, Franklin, Gulf, Bay, Calhoun, Liberty, Jackson, Washington, and Holmes counties. That's a whole lot. Okay. So if you're listening and you're in those areas, you want to tune your ears in real good for this conversation. All right. Their programs include diabetes education, tobacco cessation, a matter of balance, chronic disease self management education, nutrition education, and cooking demonstrations, community fitness classes, biometric health screenings, health insurance navigation services, breast cancer education, and scholarship programs for healthcare students. That's amazing. All right, students, here's something for you all. All of these programs are, say it with me, free. All of these programs are free and they are open to the public. And before we get into talking about BBAHEC, I'm going to give you a little bit of an introduction of Yolanda, so you know who she is as well. And so she is a public health professional at Big Bend Area Health Education Center with nearly 30 years of promotional experience. She is helping bring bilingual health education to the underserved rural and minority communities, specializing in outreach, opioid awareness, and tobacco cessation. Can't talk today. Yolanda uses that experience to be a driving force to promote partnerships in 14 counties and bring community health education to the residents of the Big Bend region. When she's not working, Yolanda and her husband enjoy being empty nesters, visiting different beach towns throughout Florida. She feels very blessed to have three thriving young adult children, a nurse, a digital media professional, and a security salesman. Yolanda, welcome to the podcast.
Thank you so much. You make me sound fabulous.
You
Thank
are.
you.
Listen, I'm so excited to have you on the podcast to talk about this particular subject, to talk about the work that you do at BBAHEC and the work that your organization does. And just so our audience knows as well, I met Yolanda at the Senior Center over at a senior coalition that we're both a part of. And I heard her speak about her organization and just knew that she had to be one of the people to come on and share this information with our community. As we said before, so much is out there. We just don't know what it is and how to access it. And so we're going to bring this information to you in this particular episode. And hopefully, prayerfully, this is going to help someone that will be able to take advantage of these services. So, what we're going to do, Yolanda, if you would start by just telling us about the Big Bend Area Health Education Center and your mission with the
Sure.
organization.
Well, Big Bend AHEC, as you mentioned, we've been around since 1995. What Big Bend AHEC is basically it's a nonprofit organization that partners up with a lot of agencies and healthcare providers in the area and the surrounding counties. Our main goal is to support the healthcare system. For example, when you are told you diagnosed, for example, with diabetes, your healthcare provider can't sit with you and talk for hours regarding this chronic disease that might either be new for you or it might be something you've been living with, but your numbers have changed. Well, what they do is they refer to agencies like mine, and there are other various agencies that help with various health issues. But we take the time because we have the grant to help you understand, learn, get educated, and learn how to live with this. It's not a death sentence. It's not anything scary. It's just a matter of learning how to live with something and making some changes. So AHEC is here to be a supporter of not just the community, but also of healthcare providers.
Okay. All right. And so that's good. So diabetes and some of the other ones that we mentioned. And so you're absolutely correct. What I found out through my doctor's office is, especially Capital Health Plan, I think they give them about 15, 20 minutes for a patient. Now, I typically will take a little bit longer if I need to, because I figure I'm paying you my money. I want you to answer at least the questions that I have right now.
Right.
But with that time frame that they are given, they have so many patients they have to see in a day. And so you don't, and I know that a lot of doctors will say, don't go to the internet, don't get your information from the internet, because it's not always the best, source of well, great source, but sometimes it brings up fears and concerns that may not be necessary for your situation. But what else are you left to do when you only have
Right.
15-20 minutes? And so that, program that you're offering, or what you all do with that health education, I think that is great to have. And so, is it just diabetes? What about things like kidney disease and some of the other diseases? Do you all also educate with
So
that?
we do various programs, and they fluctuate, they change. So because we're a nonprofit organization, a lot of our funding is grant based. And so the way grants work is either you have them for a very extended period of time, or they fluctuate. You might have a grant for a year, 2 years, 3 years, and they could change. So we have grants that come and go. But we have been very consistent for several years now with the aging programs. And our aging programs include several different programs. And I want to mention what they are, because a lot of these programs are really geared towards the senior population in our region, 60 and over. But what Big Bend AHEC does is we don't want to discriminate anyone who wants to join our program. So if you are a 40-year-old person and you have been told you might be a pre-diabetic, we still will welcome you. There's still
Okay.
plenty of you for you to learn. It's just that what we have, the health assessment that we receive from the hospitals and various other assessments, it gives us an idea, a little snapshot of which are the communities that need the most help. So we focus on them, but we are open to anyone. The
Okay.
only issue with our programs is, and this is really the rules of the grants, is we have to make sure that the person is 18 and over. That's really the only thing, because a minor would have a little bit of different program that's geared towards them. So ours is geared towards adults. So let me start off with the Diabetes Education Empowerment Program. And you mentioned you have CHP. I also have CHP. We have such an incredible partnership with Capital Health Plan that they specifically send us their patients. So if
Okay.
if you have CHP and you've been told you're a pre-diabetic or diabetic, they are sending, a lot of the doctors there are sending their patients to learn more about diabetes in our program. Our program is specifically for pre-diabetics or type 2 diabetics. And the program is a 6-week program. It covers a wide range of topics on how to manage your disease. But also, what's wonderful about our program, because there are a lot of agencies that have diabetes programs, but what makes our program a little bit different than some of the ones that are in the local area is ours is not limited to just helping the person who's been diagnosed. What we've learned is it's beneficial for the family as a whole to join the class, because most of us are having a meal with someone. We're either cooking with someone, or someone's cooking for us. Someone might be grocery shopping with us or for us. So it's really beneficial to educate the family, especially family that eats together and shops together. It would be
Mm-hmm.
beneficial for them to learn about the diabetes program. So we welcome you. Bring your partner, you bring your parent, you bring your loved one. We want that. And this particular program is the most popular right now, simply because Big Bend region, we have high numbers of diabetics, and the highest numbers are in the minority community.
Yeah.
So we
Yeah.
really want to make sure that we're reaching the minority community. The other program that we have that's also an excellent program, which kind of covers a little bit of diabetes, that's the Chronic Disease Self-Management Program. That is a fantastic workshop that aids people living with chronic disease and how to manage their symptoms. But chronic disease is a broad spectrum. So it could be somebody who is living with cancer, someone who is living, of course, with diabetes, someone who's has sickle cell, has lupus. These are all fall under the category of chronic disease. So this program touches a little bit about a lot.
Okay.
It's a great, it talks about pain, how to decrease pain, and it's a very thoughtful program. The other health program that we have that is geared for the aging community is called A Matter of Balance. And that particular program, that's an 8-week program. What's wonderful about this one is as we start to age, we start to get a little bit more nervous about falling. And that program is going to focus on reducing the fear of falling, plus increasing strength, balance, and your activity level. What's great is that program could be for someone who is chair-bound. If you are not mobile, it's still a great program because we even teach how to do activities while you're sitting down. So it isn't we're teaching run out and go to the nearest gym, or it's different programs for various mobility. And then the last one is the powerful tool for caregivers. And
Mhm.
that is a program for anyone who's a caregiver of a child, a relative, any loved one with a long-term health condition. That's a class to kind of to give the caregiver a moment to focus on themselves. It really is a program that is giving back to the person who's always giving. And for people in my age range, I'm a Gen Xer. We're now in this situation where a lot of Gen Xers have either they have their parent and they also have a child at home. So we're that sandwich
Yep.
generation. So this particular generation is unlike any we've seen before, where now we're having even multi-generations living in the same household. And this is a time for that person to person that's taking care of it all to take some time to focus on themselves. So those are my aging programs.
Okay. So with these programs, when do they? So you talk about the classes, and some of them go by weeks. And so with that, when are they offered?
So our classes, a lot of these classes either are offered virtually or in person or a hybrid. That's a combination of both. And most of the time, the classes are formed once we have interested people wanting to participate. So it, unlike some other programs where they just have a constant every month, every this particular day, this is when we have this constant program. It doesn't work like that, only because most grant related programs have a requirement, and that requirement means we have to have a certain amount of people to join in order to even launch the class. So for a program, for example, like diabetes, we want to make sure that we've got a handful of people that are pre-registered, and then we can hold the class. And we hold the class based on a specific date and time. A lot of it has to do with the location that we're going to hold it on. If we hold it virtually, we have set dates, and then we put the information out there, we promote it, we set out flyers, we put it on our social media, and then we hope to get people registered. The one thing that we do, which is also unique to us, is we'll work with an organization. So sometimes we'll get a call from like a senior center, and they'll tell me, hey, Yolanda, we're interested in doing a diabetes class or a chronic disease self-management. We've got 7 people that are interested in the program. Well, then we will gear that class specifically for that organization. And
Okay.
it doesn't even have to be open to the public. So we'll work with anyone who's interested. I would like to see, this is what I would like to see, since I know that there are so many chronic diseases in the Big Bend region. I would love to get a family of adults that contacts me and says, I've got multi-generational family members that are either on the cusp or are dealing with this. We'd like to have a class geared just to us. And we can do that, especially now with the platform of virtual. We can
Yeah.
absolutely do that. So these are programs that are meant to be shared. They're meant to educate. They're meant to take away the fear of something that you might have recently been diagnosed with, and also to empower you.
Okay. So even with Alzheimer's, right? You all touch on Alzheimer's, dementia, and I asked that question because when you talk about the family, even with the
Mhm.
diabetes and having that training, that education for the entire family.
Mhm.
So when I look at my family and I look at the family dynamic, right now I have my mom who she's living with it. She also has 3 brothers who are right now as well living with it. She had 2 sisters who passed away within the last 3 years from
Mm.
it. So all of
I'm
them,
so
right? So
sorry.
there's that family dynamic. And so this is one of the reasons why I do what I do in trying to help educate people, is the fact that, there appears to be a family genetic factor here, right?
Mhm.
And so that education is needed. I have family members who we've all seen it our entire lives. Both my grandparents, both my mom's parents had it. We've seen it all of our lives through them, through close first cousins, second cousins who also had it, but they're not educating themselves enough to know what the disease is about, the different factors, the different stages. And so when it comes to that, do you all touch on any type of dementia training as well?
So our programs are not geared specifically for that, but
Okay.
when we have the class for the powerful tool for caregivers, that one focuses on the person that's taking care of the people who are living with these diseases. The class, the particular class that we have about chronic disease self-management, that would touch a little bit on it. It touches it on a broader
Okay.
spectrum, not very specific to one particular chronic disease, but it does touch on a broader aspect of it. I will say that I want to just take a minute to say, Priscilla, I'm really impressed with the motivation that you've had through all of your family circumstances to be able to create a platform like this. It's super beneficial, and I can't say enough good things about and you doing this. I think it's wonderful. I didn't know your background completely, so I take my hat off to you, and what an amazing daughter you are.
Thank you. Thank you. Okay. So, I mean, I still think, with all of it, I think it's well worth it, because there's a lot of people that, and when you talk about too, that family dynamic, not just being able to prepare the meals, but a lot of this, it is genetic. Usually if there's a parent with diabetes and there's children, one or more usually end up with it as well. So being able to know, yeah, it may be mom or my sister who's pre-diabetic or diabetic at this point, but I think it's useful to educate. I tell people all the time, regardless of whether or not you're taking care of somebody with Alzheimer's, cancer, diabetes, what have you, one of the best things that you can do is educate yourself regarding that particular disease and its effects, because that education helps you to know and to understand. Sometimes, there are different symptoms, there's different, just attitudes and different things that changes because a person is dealing with a particular disease. You need to know and understand that, because sometimes we can get offended sometimes by people's responses, not realizing that sometimes it could be the medication, sometimes it could be just the stress from having to live with a chronic disease. You don't know. But if you help to educate yourself and you can kind of get ahead of what may be coming, when it happens, you're not thrown off, because
Yeah.
that, okay, I looked at this is a part of what could happen. So that.
A chronic disease, when you're given the diagnosis at your healthcare provider that you have a chronic disease, initially the first thing that people feel is a doom and gloom. And it doesn't have to be. It doesn't have
Right.
to be doom and gloom. There are millions of people who live with lots of chronic diseases a full, long, healthy life. It's just a matter of getting educated, receiving the education that's out there, and then learning to manage it. One of the things that I wanted to mention is what's really wonderful about the programs that we offer at AHEC is we cover, even though it's a little broader spectrum than specific to Alzheimer's, we cover things about fitness and nutrition. And we've learned that when you have one chronic disease and then you are diagnosed with another chronic disease, it really will be in the benefit of the person suffering this to learn as much as they can. There's so much power in the nutritional aspect of our lives. If you learn on how to eat correctly and how to manage your chronic disease, you will be able to. Here's the thing: is you have to look at. Let me pause a second. You have to look at food as fuel. It's fuel. You don't put just, you don't put oil in your car to make it run. You put the fuel that's necessary to make your vehicle run. We have to look at our bodies that way. We have to look at what we're putting into our body is going to help determine on how it is that our this machine is going to continue to work right. And then when you've been given a diagnosis, it's going to be very beneficial to educate yourself on what's the right way to eat. What happens with the minority community, and I'm going to speak on behalf of, I'm a Hispanic woman in America.
Mm-hmm.
The minority community, we often hang on to cultural and traditional parts of our ancestry, right? We to deviate from it is almost to you're denying your culture. But what we have to remember, especially when we have these chronic diseases, and I'm going to use diabetes right now because it is the most prevalent in the minority community.
Mm-hmm.
What happens is we stick so much with, oh, but this is how we eat. This is how grandma did. This is how great grandma. This is how my mom did. But we have to remember that we are not living today in the 21st century the way our grandmothers did. We don't have the same type of jobs. We don't have the same type of lifestyle. I mean, I use my grandmother for my inspiration for a lot of things, but my grandmother had to walk to the grocery store, walk to the post office, walk down 6 flights of stairs on a New York City walk up. There wasn't even an elevator. So even as an elderly woman, she was still quite active
Yeah.
because of the environment that she lived in. Now, I come from humble people. They worked in, the cane sugar field. So I'm not working that way. I work in front of a computer, in front of a laptop. I speak, I use this more than the rest. So we have to remember that even though culturally we have been taught to cook a certain way and to feed our families a certain way, if we want to reach an optimal age that everyone has. I don't know of anyone that says I don't care what age I leave the planet.
Right.
Most people want to live a long, healthy life. So we have to start making changes within our community so that we can activate that part of us, so that we can live a long, healthy life, especially when we're members of the minority community. The top 3 communities that suffer from diabetes is the Native American community, the African American community, and Hispanics.
Yep.
And I equate that issue to the way that we're eating versus the way that we're burning those calories, because a lot of us have sedentary jobs. So the programs that we have will touch on educating you on how to change that, how to change, I'm Hispanic. We eat rice and beans, but there was a time where I grew up where we were eating rice with pasta and bread. I mean, right there. Now, you know better, you do better. We know that that's too much carbohydrates
Right.
to maintain a healthy blood sugar level. So programs like ours, we do biometrics. So if somebody's interested in getting their, you might not have health insurance, but you want to know what your numbers are. So we'll do your A1C, which an A1C biometric screening gives the patient or the participant a snapshot over the past 3 months on how they've been doing. How have they been eating the past 3 months? Not how you ate yesterday or this morning. It's a snapshot on seeing how you're doing. And then at least that gives you a number where to start. So once you know your number, then you have a goal. I want to lower it. So let me make these adjustments and changes here. Perhaps it's not even changing your eating habits. It might be changing your moving habits. So you just start moving after you eat a meal. That can make all the difference. But I want to emphasize that it's not specific to minorities, but minority communities, we often eat the way our traditions have taught us. And that's the only thing I would like to get for minority communities to understand is tradition's awesome. I'm a big fan of tradition and keeping culture alive. I'm very pro culture and I speak Spanish, but it's very important that we start to learn. If we're not living the same way that they lived, our ancestors, we need to start changing it so that we can change the numbers of diabetics in our communities.
Absolutely.
So that's the biggest factor when I look at how do we change things in the community is we need to first start with what are we doing that is working against us?
Mm-hmm.
And one thing that we're doing is we're continuing the same pattern, but we're not living the same way that they did.
Absolutely. So we got to let go of that. I'm going to say it, that fat back and all that grease and, because that is, and if you look at it, a lot of these diseases that become chronic diseases, a lot of them are tied to
Food.
what we eat and a lack of exercise.
Mhm.
We don't, like you said, we're sitting at our desk most of the day. And
Yeah.
so, I've had to, over the last month or so, had to change my eating habits because I too grew up in the house with rice with every meal. And
Mhm.
so what I'm learning is no, and I wasn't drinking a whole lot of water. And
Yeah.
so now I drink a whole lot more, but that's because I had to make a personal choice to say, you know what? I just turned 50 in December and I'm like, no,
Yeah.
the older you get, your metabolism slows down. And if you're not going out and really, actively walking or doing some type of exercise, then that food that you're eating, it's building up and then
Mhm.
you end up with these issues. So I absolutely agree with that. Even when you talk, we look at the height of COVID. What
Mhm.
was it? The same thing, the eating, the diabetes, the high blood pressure, all these factors that were, high factors for people contracting COVID.
Mhm.
Um, and
Yeah,
so,
there were a lot of people contracting it that had some health issues. There were already underlying diabetics,
mhm,
asthmatics. I mean, there were these baseline issues that they had, and then COVID struck, and it really shined a light on people having living with chronic diseases and how weak they could be, how excuse me, how weak their bodies were and how they were affected.
right.
We,
And so
we
let
want
me ask this question, even and think about that, because I know, and I say it a lot when I'm having this discussion, with some of my friends and stuff. It's always, when it comes down to healthier foods, they are a lot more expensive. But
yeah.
when you look at that, what do you all tell people that, you encounter in your programs who say, hey, I want to eat different, but it is more expensive when you're having to buy the healthier foods. And so how do you work around it, or what are you telling them in that situation?
So coincidentally, I'm a cook. I can throw down in the kitchen,
All
Priscilla.
right.
But what I have learned, because I have been strapped financially. I didn't grow up in an affluent home or an affluent neighborhood. I will go back and say I learned from my grandmothers on how to feed many with little. You
Mhm.
don't have to have the I mean, no shade to Whole Foods, wonderful, great, who can afford it, but you have to, you got to be a smart shopper. You have to be a smart cook. Not every meal is requiring that you have high end everything. You have to learn, how can I make something healthy, and think about how it's affecting your body. I think what really people need to concentrate is people need to learn how to cook. People
Yeah.
need to go back to the way things were. Sitting down to a meal, it takes a minute to get to that process. I'm a woman that I come home every day and I cook dinner for my family. But for me, it comes easily just because I watch my grandmothers and I am conscious about what I'm putting in my body. My 91-year-old dad lives with me. I will say that we just have to go back to the way things were once upon a time and learn. Um, let's try and get out of the processed food section of the grocery store and do a little bit more homework and think about how we can have some more of the whole foods and whole grain food. Yes, food is expensive now, but all food is expensive now. But we have to figure out on how to cook smarter and cook with using basic ingredients that exist that are not break the bank. Rice isn't a break the bank. Beans aren't break the bank. I go through the grocery store often. Sometimes some of these classes that we teach, we do a nutritional part of it. You'd be amazed on how you can really pack on nutrition with foods that don't break the bank. It's just that we've gotten to this. I think we've gotten to this pattern as a country that we're making things fancier that don't need to be quite so fancy. The goal is to get the right nutrition into your body, to put the fuel in your body. Everything, of course, we want it to taste good and look good, because part of the way we eat is with our eyes,
Yeah.
and with the sense of smell, and of course the sense of taste. But you really can feed a family without breaking the bank. You just have to do the work, and that's where I think the break is happening, is people want everything fast. We also work more than I think than, our previous generations. So there is a balance, but I think that I don't have the answer completely, but I do know that part of the answer is we have to work a little harder about how we're going to prepare foods for ourselves and for our families, because
Yep.
that should be the priority.
Yep. Do you all provide recipes that, you know?
We do a nutrition class. Actually, we have a nutrition class. We have a nutrition and fitness class, and we go through education. And during those classes, we'll also do your biometric screening, where we'll do your blood pressure and check your blood sugar levels. And what's great about that particular program is that when they show you nutrition, they even bring something and they break it down so you know how much protein you're getting, how much carbohydrates, how much it costs. So it gives you ideas on how can I get dense, rich food into my body that's good for me, that's going to fill me up, and it's not going to break the bank. Our program, our nutrition and fitness program, goes through that. I will say that this particular program, we often take it to senior centers, because we get this question a lot from seniors, because you also reach a certain time in your life where you're just exhausted. You spent your life cooking for everyone. You'd like, and especially, and a lot of us we're cooking for one or two.
Right.
So, that's an adjustment. I can speak for,
Yeah, I
I had
can
a family of 6, and I've had to learn how to adjust, cooking for 2 to 3 people.
Yeah.
But it is a program that covers all of it, and it also helps you to understand how much protein you need, how much carbohydrates, what is a simple carbohydrate versus a complex carbohydrate. We cover healthy fats versus unhealthy fats. It's a great educational program. What I have to say about our program that I think is really, really beneficial is it's taught in a language that everyone can understand. Because I don't know about you, Priscilla, but when I'm sitting at my doctor and they're talking to me with medical jargon, I didn't go all those years to school to
Exactly.
study medicine, and it goes right over my head. Or I see them talking to my dad, and I look at them and I'm like, can you break it down so a
Break
common
it down
folk
in
can
layman
understand?
terms. Yeah.
Yeah, so that's how we teach our classes, so that anyone, any education level, can come in and get it and absorb it and understand it.
Okay. All right. Well, let me ask this question. So, with your programs, they're free, they're open to the public. How do you make sure that the people in the community know about your services and feel encouraged to participate in them?
So our programs, well, I'm one of the main sources to get the information out. As that's how we met during an
Right.
outreach meeting. But one of the things that we do is, first of all, because we've been around for so long, Big Bend AHEC specifically has been around here for over 30 years. We have an incredible relationship with community partners in 14 counties. And because of those partnerships that we have fostered and we continue to grow with, we're able to share. We share info. And like I said, Capital Health Plan has been gracious enough to not just sit with us, but to learn about the program and to really become an incredible partner in sending their diabetics, because they sat through some of our classes and they wanted
Mhm.
to learn what is it about this class, including our tobacco cessation program. So what we do is we use social media in our favor. So like I mentioned before, if you really want to know what's the latest and greatest going on in your community, everyone listening to your podcast should start by going to social media and following some of the major agencies, some major lead agencies that have resources that are free. So I will tell you, I'm going to promote myself first, of course. Big Bend AHEC, follow us. Go on Instagram, go on Facebook, go on X, formerly Twitter, and look at what we put on there. Because we live in a world where we want to have partnerships. You asked me about Alzheimer's and dementia. Well, we don't focus on that, but we have community partners that do.
Yeah.
But what's great about us is that my community partners, I ask them, send me what you've got. We'll post it on our social media.
Mhm.
That's how one way that we collaboratively work together, so we support each other. We don't do it all. Not all agencies can do it all, but we do a lot, and then we support each other. So Facebook, Instagram, X, formerly Twitter, and then go to our website. We put stuff regularly. weekly, daily, sometimes multiple times in a day. And I will put stuff from my community partners. So when the Alzheimer Project's got something going on and they send me a flyer, I'm putting it on our social media. When other agencies, Department of Health has something going on, some type of screening, we put it on our social media because we want everyone who's following us to stay connected with what's going on. You know, we're all we work in these in the public health sector, and sometimes a person doesn't even know where to start.
Right.
I sometimes I'll get calls, hey Yolanda, I don't even know where to go. My child needs a bed and I live at a certain poverty level. Okay, there's an organization for that. So if you get to the opportunity to follow some of these social media sites for these nonprofits, you're really going to start to learn about everything that's out there. And I can't recommend that enough.
Yeah, I agree with that 100%. I do the same thing. That's one of the
Mhm.
reasons why, I mean, on my website, I have all this information out there too. I started the resource spot. And so I have a event side out there. I also have, the support side, and anything I know that's going on, it's out there on the website. I'm sharing this stuff on my social media platform because, that collaboration is great. And I have people that call me and they want to know, just like you just said, where do I start? And so
Mhm.
I built and started building those relationships so I could say, hey, go here. Hey,
Mhm.
go there. And so I want to also give this information since Yolanda just said it. I want you to get the information for their website. Their website is www.bigbenahec.org. Follow them on Facebook, Instagram, and X at Big Ben AHEC. And again, that's Area Health Education Center. Or you can give them a call at 850-224-1177. And the great thing about it, she said it earlier, she also speaks Spanish. So we're going to say this again. Se habla español.
Sí,
All
yo
right.
hablo español.
There it is. And so, that's a good thing. She's bilingual. So it's not, if you speak English, Spanish, great resource for you right there. But please do connect with Big Ben, AHEC, and Yolanda and what they're doing. Now, I also have this question because, I'm very active in my church community. And so even with your program, I know you mentioned earlier about organizations. So if it's a church that is interested and having this education at their particular church, that's something that you all are open to as well, right?
Oh, absolutely. We do this a lot. You know, I don't know if I'm allowed to say a name of a church that I just
Yeah,
did
yeah,
something with.
yeah,
So
absolutely.
this past Saturday, I did an event, a presentation at Flipper Chapel AME near FAMU.
Okay.
They invited me. They invited me to be a guest speaker, and they were such. It was a women's ministry, and they were incredibly gracious and so welcoming. And they asked me to come in to talk about our programs and nutrition. I brought one of my team members with me. Keith did biometrics. He tested their blood sugars and their blood pressure. And I talked about all our programs. And I even, because we have a grant to provide opioid education, I provided everybody that was there with a box of Narcan so that they can save a life. Opioids is a crisis that's going on in America.
Mhm.
It's really affecting our rural community, and we have there's an over the counter medicine now called Narcan. Well, the medicine is naloxone. The brand name is Narcan, and I now am able to give away until the grant no longer exists. I'm giving away Narcan. Now there is a community partner in town that they are by far more related to anything that has to do with addictions and dependencies. That's Disc Village. But they were so gracious that they said, "Hey, Yolanda, this is a great place for you to be able to also help the community." I love doing churches. I learned during COVID. So I'm from up north, and the church community there is a little different. It's a little different than the way it is in the South. And I have such an incredible respect and admiration for how the church community is here in Florida. One of the most important parts of the church community that I learned, I was humbled observing during COVID, the pulse on the community was the churches,
Yep.
because Everybody was in fear. Nobody knew what to believe. There was such a conflict of what was being told by our political administration versus our healthcare professionals and scientists. And so there was such a confusion and such a fear. And what I saw firsthand, because I was boots on the ground with a couple of my coworkers where we were in full, gear. Nobody knew what was this that was, taking lives. But we were out there helping get people registered to get tested. And I was boots on the ground in Gadsden. I worked together with their health department as a volunteer. And what I learned was that the church community was really where all the information got disseminated. And I have such a respect for that, because without the church community, so many people would have been lost.
Yeah.
So if I can say one thing, and if nobody remembers anything else, I want you to remember the church community in Florida has such a strong trust and connection that I would love, me personally, Yolanda, would love to be able to get into all the churches and hopefully inspire them to start a health ministry.
Yeah.
Because the church has such an incredible and powerful voice, I think that it's really important. I think church leaders need to pause and take a minute and think beyond just the gospel, but remember that part of the gospel is to take care of this temple, which is your body.
Mm-hmm.
And I feel strongly that if we could get ministers in the community to get a little bit more involved, the amount of information and resources that are out there would be so beneficial to the congregants in the community, specifically minority communities, because minority communities often have a little bit of a distrust issue with healthcare. And I understand that. I mean, my family comes from Puerto Rico. There was a whole lot of issues that happened. I don't want to get into that, but, Google it. Puerto Rico had a very unsavory relationship with healthcare in the 50s and 60s. And I get that, and I understand that, but I will tell you that without the church community, a lot of what was happening during COVID would have been lost. We needed them. They were so beneficial for us, especially the people who worked in public health. So this is a call out to ministers, reverends, priests. We need you. We really need you. The minority community needs you. And we'd like to get into the churches. And I share information. When I go to a church and they are gracious enough to invite me, I bring a little swag for everyone to take with them to enjoy. And I bring a plethora of information.
All right. So I'm going to tell you, we have a health ministry at my church. And so I'm going to be speaking with them about getting you in. We have some health stuff coming up, but I'm going to be talking with our health ministry leaders about bringing you in. And then I do know quite a few other
Awesome.
ministries that will also be working to do the same with them. And so I am absolutely loving your program and what it is you're doing. Go ahead. You have something to...
I just want to say, because I went off the detour in a minute. I wanted to answer your question specifically. Yes, we will do a class in a church. So if you have a population of people, if you get me a handful of people, we'll bring the class to you. So we could work in an evening. We could work on a Saturday. We can bring a class specifically to your congregation.
And would that class be just one class, or is it a series? Would it be more than one day?
Okay. It depends on the program, but most of them, I will say, are a series. And so you just pick a date and time that works for you, works for the church and the members, and we will be there.
Okay. All right. And you will also do that. You can also do that virtually, right?
Yes. Virtually is always an option, or even the hybrid for anybody who prefers in person, and those that are homebound or want to stay home. We can do both.
All right. Because I have an idea that I'll share with you after we get off of here. Okay.
Perfect.
All right. So let me ask this question as well. You all are already doing some pretty amazing things. And I know that, as you stated before, you're all grant-based, and, your programs are centered around your particular grant. Are there any grants that are being written up or looked at for any new initiatives or programs that, you all may have planned for the future?
Oh my gosh, I'm so excited to tell you about this. Yes. As a matter of fact, before I left my office today, I spoke to our aging programs manager, Stephanie, and I said, tell me about what's the latest and greatest. And so this is what's coming down the pipeline. We've got a program that's going to be coming down probably the second half of this year. It's called the Tai Chi for Arthritis and Fall Prevention.
Okay.
And that program, I'm super excited because the one thing that I have been asked, I've been with AHEC for 7 years, and I get asked often by the senior population, do you have a program that's geared just towards seniors exercise? And I talk about our other programs, but then they come at me and they say, but do you have Tai Chi? Because it's become popular, more popular. And a Tai Chi, what's wonderful is a program that it's actually something that comes from the Asian countries. It's more popular in the Asian community, but it's starting to pick up here. It's a program that's made for people to move in slow movement, slow motion, in order to help them with balance and strength. It is a program that's, again, our programs will be for anyone over the age of 18, but it is focusing on the senior population. But then there's another program that will be coming also, and that one's called Bingo Size. And Bingo Size combines playing bingo and exercise. I don't
Okay.
have too much about that yet. I don't, because we're in the process of, we've got our team getting trained because, we have to have certifications to do this. So
Mm-hmm.
our team is in the process of getting certified. But I will say this is an evidence-based program. The Tai Chi is an evidence-based program. And the target audience, of course, is going to be seniors. But once we have that, locked down and all my team is certified, I promise you, I'll contact you. We'll do this again just to talk about Tai Chi.
Yep. Yep.
And we're going to put it out on social media. So that's why it's so important to follow us, because that's where we're going to put whatever's the latest and greatest happening at Big Bend AHEC. And I would love, love, love to get that moving once it's confirmed and my team members are certified.
Okay. And see, that's something else that can be brought to the church because you have a lot of
Mm-hmm.
churches with seniors. And
Yep.
so, they can get involved in that as well if they so choose. That's exciting. That is
Yeah.
exciting.
Yeah.
And so, one final question that I'll ask
Mm-hmm.
you, and this is, when it comes down to you, what has been your personal motivation for working in health education, and how do you stay inspired by the work that you all do at Big Bend AHEC?
Well, that's a good question. So my main well, let me just start with this. I'm a child of immigrant. I'm first generation American. I grew up without health care, along with the rest of my family. And whenever I was sick, whenever I had anything, I went to FQHCs, which is a federally qualified healthcare clinic or center. FQHCs are the clinics, like locally it would be like Bond or Neighborhood Medical, where you pay on a sliding scale.
Okay.
I grew up going to those clinics, and when those clinics didn't exist, sometimes I'd have to sit all day in the ER at a public hospital because we didn't have insurance. Not only did we not have insurance, but because my parents, spoke Spanish and were not savvy with all things, in the United States. We didn't know about resources. My mother would never even know where to begin to start to find resources. She comes from, limited education and a humble background, and I remember the struggle. And it's very personal to me, because I remember there were times where it was, if I got really sick, and I used to suffer a lot from asthma, and I still have asthma, but now it's managed because I have
Mhm,
healthcare
mhm.
insurance. But when I didn't have healthcare insurance, an inhaler could cost a couple $100.
Yeah.
And, that meant that we went without skipping paying a utility bill so that I could get the inhaler. And, I have memories of not having electricity on because we had to buy me a medicine. That motivates me because as I started getting older and I'm bilingual, my mother would say to me in Spanish, Yolanda, my friend Gabriela needs this. Do you know where? And I'm a teenager, but because I spoke English and I was always, kind of like I was always kind of a spazzy kid, kind of hyper, kind of always interested in learning about things. My mom would come to me as at 14. Can you find out where can Gabriela get this, or where can Peggy get that? um, because she knew she had a daughter who was going to try, kind of like you, Priscilla.
Yep.
I was a
Gotta
precocious
figure
kid,
it out. Yeah.
and I figured it out. So that, when I think about what motivates me every day and why I love working at AHEC, is that I think about, even if I only help one person, that's one person that there's been a difference that's been made in their life. One of the programs that we have currently, is the Navigator program, and that's the Affordable Care Act Federal Marketplace Health Insurance. That program, and and I know we're going through a time right now in our country that things are in limbo, or things are in might be changing, but I can speak for what my experience has been with the federal marketplaces. We have helped a lot of people get health insurance that either have never had health insurance or had lost their health insurance. That motivates me. That
Yeah.
motivates me because I was that kid. I'm from that family that, we had to figure out whether we were going to pay the light bill or get me my asthma medicine. So what keeps me inspired is any opportunity that I can learn, because I'm always learning, so that I can share, like I'm doing here through your grace of inviting me, and educating communities. And for me, because we often talk about communities as a whole, but the minority community is what motivates me, because I often see, in my experience, I'm originally from New York and I grew up between New York, Chicago, and Houston. There, minority community always is the one that seems to struggle with learning where the resources are. So for me, one of the things that I'm trying very hard is I want to get the Spanish speaking population to also understand these services are for you too. Don't let a language barrier be the reason that you don't get some help.
Yeah.
So that's what motivates me. I have firsthand experience of struggling, and I'm hoping to help another person that struggles, and not be afraid to get to these programs. And the big thing, every nonprofit will tell you, we got a lot of resources out there, but they're only good if people use them. And
That's it.
unfortunately, and I'm sure you know this, Priscilla, if we have grants that are out there and people aren't using them, sometimes they get pulled. You use them or lose them.
Yeah.
Sometimes funding gets reallocated. Oh, that one's not being used. We're pulling it. We're putting the money someplace else. So I can't emphasize enough to all of your listeners and anybody that you know, if there's a program out there and it suits your need, use it so we don't lose it.
Yep. Take advantage of it. And that is what
Yes.
this is all about. We're not just bringing you information for you to hear it, but if you're a listener and maybe it's not for you at this moment,
Mhm.
but somebody else that can benefit from these services, please, by all means, share the information, share the podcast, share the information. Again, you can reach Big Ben AHEC. Visit their website at www.bigbenahec.org. Follow
Mhm.
them on Facebook, Instagram, and X at Big Ben AHEC. You can look for Area Health Education Center. You can type that in the search and it'll come up.
Mhm.
Big Ben AHEC will come up, or give them a call at 850-224-1177. Please share the information, and beyond sharing it, take advantage of it, because we don't want them to lose the grants and these are free. Again, they don't cost you anything but your time. You
Nope.
being able to contact them and get the help that you need. A friend of mine and
We're
I,
equipped to help anyone. We're
yeah,
equipped to help anyone. You have mobility issues, you have vision issues. We're equipped to help anyone. So just keep that in mind, and we'll make special accommodations. Call us. Ask for me. I'm Yolanda. And if there's a special circumstance, I'll give you, for instance, there was a lady, they lost their house in a fire, and she was wheelchair bound, and she had joined our tobacco program, and she really desperately wanted to continue being on the tobacco program, but she couldn't get out to our location where we're having classes. I went to her. I sat one-on-one with her and did a
wow,
class with her in the hotel that FEMA had set her up in, because her house had burned down. So we will, depending on the circumstance, we will do our best to try and
yeah.
meet you where the need is. But Priscilla, I want to tell you something before I forget. We've got a big incentive program, and we don't often have incentive programs that pay you money.
All right.
We got an incentive program right now, and I got word before I left my office today that it just got extended through June. So the Bureau of Tobacco Free Florida which we are the people who do their group quit sessions for anybody who's addicted to tobacco, nicotine products. We have a program where we can help you. There's a 4-week program called Quit Smoking Now, and we do a virtual class. If you join that program, you can get up to $125 in a Walmart gift card. And that was a promotion that started for the new year until the end of February, but they just extended it today until June. So I want everyone who is struggling with any kind of nicotine, and I'm talking to the minority community who's in denial about certain things
About
being
being
addictive.
addicted. Yeah.
Cigarillos, cigars, electronic nicotine devices, that's your vaping products. Please, nothing's meant to go into your lungs except for the air that we breathe, and medicine if you're an asthmatic or some form of breathing issue. That's it. So if you want $125 in gift cards, and we give you free nicotine replacement therapy, call us. Call Big Bend AHEC. Inquire about it. I'll tell you what you need, and we teach it in Espanol also.
All right. You heard it here, not first, but first time on this podcast. Get in contact with them. 850-224-1177. And we didn't really get into talking about the tobacco part of your program. Give us just a little snippet of your tobacco program and how that works.
So our tobacco program is also a free program, and that is funded through various sources, but the most commonly known one is the big tobacco dollars. When the tobacco industry got sued, our AHEC was formed among other AHECs, and our main goal is to help the community 18 and over to quit using tobacco products. Oftentimes, the dependency of tobacco creates withdrawals, and we work through it. Of course, if you're a pregnant person, if you have certain medical conditions, before we prescribe you any nicotine, or not prescribe, excuse me, it's over the counter. Before we give you nicotine replacement therapy, we would want, of course, the approval from your doctor, specifically pregnant women. But we are here to help you. I'm a former smoker. I began smoking at the age of 11. I quit right before I turned 30 because I wanted to have children. And I'm now in my mid 50s and I've been tobacco free. I highly recommend, if you're struggling or if you're in denial, I would suggest considering quitting. It doesn't cost you anything but time to come and listen. And we're going to give you the tools to quit. When you're ready, you're the person who makes that decision, but at least you have in your back pocket the tools of information for when you actually are ready to quit. And you know that we're a resource for you. We'll help you virtually. We'll help you in person. We'll even help you on the phone. And then once you used our resource, which is the group quit part, the commercials that you see on TV, they give you several options. With the group quit part at Big Bend AHEC, you're going to talk to a local person. I'm one of the facilitators. We will also guide you to the phone quit option or to the web quit option, just so that you know that there are other sources out there for you. This is an excellent program.
Yeah.
Lots and lots and lots of people quit because they learn. First of all, you're going to learn about why you're addicted, what's in your tobacco, and all the reasons that you should be looking forward to in your life. So please give us a call. We want to help you.
All right. There it is. And so as we wrap up today's conversation, it's clear that the work that's being done at Big Bend AHEC is not just about improving healthcare access. It's about empowering individuals, building stronger communities, and health resources. Big Bend is paving the way for a healthier future, one person at a time. And so listen, if you have been inspired at all by today's episode, what we want you to do is know that you have a role to play in strengthening the health of our communities. Once you get healthy, other people around you get healthy, then we are strengthening our community, and everybody is able to live healthier lives. And so, Yolanda, thank you again for joining me on this episode of the podcast for this much needed conversation and this much needed resource for our community. And so, again, the information is out there. It will be placed on my website at www.priscillajjohnlouis.com. When you go on there, go over to the resource spot tab, and you'll find the information there on how to reach them. There'll probably be just a logo or something there, or actually just their name. You can click on it. It'll take you to their website and have all that information, because we want you to be able to live your absolute best healthy lives. All right. So thank you again. And I look forward to you all listening to the next podcast. Talk with you soon.
Thank you so much.